Welcome back to Fox 8 News in the morning. Well, with restaurants, retail, and other businesses opening once again, there are concerns there could be a second wave of coronavirus infections here in the state of Ohio. There's also concern over a COVID-related syndrome affecting children. So we brought in Dr. Amy Edwards again from University Hospital. She's joining us this morning. Doctor and I were kind of chatting during the break. It was a busy weekend where you were at over at UH. So where do we stand today after the weekend?
We're actually doing okay from a COVID standpoint. One of the reasons that we're getting busy is because a lot of patients are coming out of their homes and they're finally coming to seek care for all their other problems, which we very much encourage people to do. We have had a spate of people coming in that waited longer than they should have, and they're coming in much more ill than they should have done. And so I want to encourage people, no matter what's going on with COVID, we're taking a lot of safety measures, both in the emergency room and the hospital, to keep COVID patients away from everybody else. And so we really don't want to see people delaying care because they're afraid of COVID. It's not good for their overall health. We really need to see you when you're sick.
Doctor, you and I spoke briefly last week about this mysterious inflammatory disease with these kids. UH had some. So can you talk about how the kids are doing now after a week since you and I spoke, and have we learned any more about this?
So the main thing that we've learned is it does seem to be wherever there's COVID. We now have reports out of Italy, in addition to the UK, of course, New York, here in Ohio, and other states all across the United States. Wherever they're reporting kids with COVID, they're reporting kids with this disease. So I think, the epidemiologic link is becoming clearer and clearer. The kids, for the most part, the kids do fully recover. There are some kids who have some lingering problems with their hearts, and so that's something we have to keep a very close eye on. And unfortunately, in New York, where their outbreak is the largest, there have been a few kids that have died from this inflammatory condition, but the vast majority of kids seem to do just fine.
Have these kids tested positive for COVID-19?
Mm-hmm.
Okay.
Yeah, they either test positive for the virus at the time, or we find antibodies, and the family tells us, oh yeah, we were all sick, 3 or 4 weeks ago.
Interesting. All right, swimming pools are opening next weekend. What are your advice to parents for those who are heading out? And we keep hearing chlorine can kill the virus. Is that true?
Yeah. Oh, yeah. Respiratory viruses are pretty wussy when it comes to that sort of stuff. Remember, we chlorinate pools to prevent the spread of gastrointestinal disease like norovirus and E. coli. And coronavirus isn't going to stand a chance against that level of chlorine. So pools, actually, I'm very okay with that. Pools, oceans, even lakes. The water, even without the chlorine, the water is going to really dilute out the virus pretty dramatically. For me, it's not the swimming itself, the pool. It's the
congregating
places that you congregate around it, the sitting room, the changing rooms, and the bathrooms, and that sort of stuff.
Concession stands. Right.
Exactly.
All right, doctor, I have to wrap this up, but what about daycare is opening on the 31st? That's so hard. That age group is so difficult to separate.
It is, and I know they're doing everything they can as far as, wearing masks and keeping the class sizes low, which I really think is about all you can do. Mm-hmm. I know there's some parents that have got to put their kids in daycare. I know it's a really hard choice for them, but at this point, it seems that inflammatory syndrome is really rare. Most kids don't get it. Okay. And so I think, with low class sizes and aggressive hand hygiene, maybe it'll be okay, but it is something that we have to think about.
Yeah, it is. And it has to be okay for these parents who have to go back to work, All right, Dr. Right. Edwards, thank you. We so appreciate you every week.
Yep. Have a great day.
You too. Dr. Edwards from UH Rainbows this morning. Coming up next.